Do you have emetophobia or a fear of nausea and vomiting, and you're about to deliver a baby and you are really scared of feeling nauseous and sick in the labor and delivery process? My name's Sydney. I'm a labor and delivery nurse, and I'm going to provide you with some tips and tricks on how to cope with this. So the first thing I want to say is make sure you are very transparent with your care team. When you go in to have your baby for the first time, second time, third time, make sure you tell them, hey, I have a really big fear of actually vomiting or feeling nauseous. So if we can do everything we can to help prevent that nausea, I would really appreciate it. Now, this might sound simple, but it will really go a long way, and just communicating with your care team will help them to be able to care for you better and in a way that makes you feel more comfortable. I have worked with lots of people in the past who are extremely scared of vomiting during labor. It is not that uncommon, so don't feel like you are weird for bringing it up. You're not. It is very common. And trust me, no one likes to be sick, so don't worry. We are going to make sure that you feel your best when you are having your baby. We, as labor and delivery nurses, have lots of tricks up our sleeve on how to prevent nausea in labor. One of them is to smell an alcohol swab when you get a little bit of that wave of nausea. That can actually help trick your brain and make you feel less nauseous. We can also give you lots of medication through your IV, so you actually won't even need to swallow anything if you're feeling really sick. So we can give you all kinds of really great medications that will really help to subside that nausea that you're feeling. And we can also make sure we're keeping a really close eye on your blood pressure, because sometimes after you get an epidural or if you're in a C-section, your blood pressure can drop, and this is what makes you feel nauseous. So if we can get ahead of that and make sure you don't get to that point, then you will feel a lot better. And just so you know, if you do vomit or feel sick in the labor and delivery process, we are here to help make you feel better and to cope with that. If you are having anxiety about it, just talk about it and we can help walk you through those thoughts that you are having. Another thing you can actually try doing in labor and delivery, which some hospitals do actually strictly recommend, is to have clear fluids only while you're in labor or in the active phase of labor. And this will help because if you do feel nauseous, you won't actually vomit anything up. You might just be heaving, and this will help to kind of reduce the amount of contents in your stomach throughout the labor process. Now, again, listen to your own team though. This is not something that I would recommend for everyone, because some people it is really good to eat and drink in labor, and then other people it isn't. But this is something that might actually be beneficial for you.